Today we're continuing to answer the question of how we know with no reasonable doubt that exposure of susceptible babies and children to acetaminophen is causing many, if not most, cases of autism. So right now we're on part 9, line of evidence number 17. It's part 9 in the video series. You can find it on Instagram and on YouTube. So this line of evidence number 17 is actually an exception to another line of evidence, number 9, which was in part 4 of this video series. So again, line of evidence number 17 is an exception to number 9. So if we really want to understand 17, we've got to go back and say, okay, what was 9? And we'll just look at line of evidence number 9 very briefly. So line of evidence number 9 tells us that there's a lot of things that cause oxidative stress. We already know what those are. It can be anything from genetic issues to preterm birth, problems with vitamin B, antibiotic use, just being sick in general. Those things cause oxidative stress, and then oxidative stress makes you susceptible to acetaminophen. We understand, we work with pharmacologists on this and people who study drug metabolism. It all adds up. It makes sense. Again, going back to line of evidence number 9. So all of these things that cause oxidative stress that I mentioned, they're associated with autism because it makes you susceptible to acetaminophen. Now that's the history. That's what we've already talked about. But what about this current line of evidence, number 17? It's an exception. It's a very, very fascinating exception, which at first we didn't understand. So there is a condition called cystic fibrosis. It's a genetic condition which has extremely good treatment today. But back in the day, back in the 1990s and 2000s, even up to 2015, when I was working on this with lung transplant surgeons, there was no good treatment for this. So it was essentially a death sentence. It's very sad. There's a lot of mental health concerns knowing that you're going to die young. So the medical literature was monitoring this, and I was working with these surgeons who were transplanting lungs into these patients, and what would happen is the patients would get sicker and sicker and their lungs would finally fail, and the only possible option was a transplant of a lung from a healthy donor. So in talking to the surgeons I was working with, they said, look, we just haven't seen patients with autism. And it's like, wow, okay, well, cystic fibrosis has a lot of oxidative stress, especially in the digestive tract and the lungs. So why don't we see autism in these patients? Well, it turns out that in all the monitoring of mental health in these patients, because again, they have a death sentence, autism is not mentioned. So it seems like they don't have autism, even though people are looking carefully at their mental health. So that is an exception to that rule that we mentioned, which was evidence part number 9. So how can this be? Well, it turns out, and if you look in the literature, the scientific literature, you'll see that patients with oxidative stress, patients with cystic fibrosis, do have oxidative stress in their digestive tract, in their lungs, but they don't have it in the rest of their body. In fact, they're the opposite. They're like super unoxidized in the rest of their body because scientists think their body's trying to compensate for all this oxidative stress in their GI tract, and it sort of flipped around in the rest of their body, including the central nervous system. And a couple of studies looked at, well, how do they metabolize acetaminophen? Well, it turns out they're super metabolizers of acetaminophen. So if you need to treat somebody who has cystic fibrosis with acetaminophen, you have to use higher than normal doses because they metabolize the drug so efficiently, which makes them resistant to acetaminophen-induced injury, which makes them essentially immune in some ways to autism, at least relative compared to the average individual. So this explains why there is an exception to our line of evidence number 9. This is line of evidence number 17, dealing with an apparent lack of autism in patients with cystic fibrosis.